Self-isolation removed for double-jabbed close contacts from August 16. From Department of Health and Social Care and the 𝗧𝗿𝗱𝗲𝗶𝗁𝗱𝗮 published 11th of August 2021. As double-jabbed people identified as close contacts are still at risk of being infected, people are advised to consider other precautions such as wearing a face covering in enclosed spaces, and limit contact with other people, especially with anyone who is clinically extremely vulnerable. They will not be required to self-isolate while they wait for the results of the PCR test. Double-vaccinated adults will no longer be required to self-isolate from Monday, as long as they received their final dose of an MHRA-approved vaccine in the UK vaccination program at least 14 days prior to contact with a positive case. Anyone who tests positive following the PCR test will still be legally required to self-isolate, irrespective of their vaccination status or age, in order to break onward chains of transmission. Meanwhile, anyone who develops COVID-19 symptoms should self-isolate and get a PCR test, and remain in isolation until the result comes back. Although 2 doses of vaccine will greatly reduce your own risk of becoming unwell with COVID-19, it is still possible to contract the virus and pass it to others. So if you develop symptoms at any time, vaccinated or not, you should get a test and be very careful in your contact with others until you have received a negative test result. Although 2 doses of vaccine will greatly reduce your own risk of becoming unwell with COVID-19, it is still possible to contract the virus and pass it to others. Anyone who tests positive following the PCR test will still be legally required to self-isolate, irrespective of their vaccination status or age, in order to break onward chains of transmission.
What about all the fully vaccinated people who get the breakthrough infection? Can they pass it on? Could they pass it on to their children? Could they pass the virus on to older people, especially more vulnerable people with underlying health conditions?
And that's exactly the point that we made in our guidance. So yes, they can with the Delta variant. And that was the reason that we changed our guidance last Tuesday. Our vaccines are working exceptionally well. They continue to work well for Delta with regard to severe illness and death. They prevent it. But what they can't do anymore is prevent transmission. So if you're going home to somebody who has not been vaccinated, to somebody who can't get vaccinated, somebody who might be immunosuppressed or a little bit frail, somebody who has comorbidities that put them at high risk, I would suggest you wear a mask in public indoor settings.
Especially if there is a breakthrough case, you get COVID, you're fully vaccinated, but you are totally asymptomatic, you could still pass on the virus to someone else. Is that right?
That's exactly right. And that's where our masking recommendation came from.